Today, let us see one of the basic topics in implantology, the bone density classification by misch. Before treatment planning, we need to know the bone density in which site we are preparing the implant so that we could decide the treatment plan based on that. Before starting with the classification, let us see four basic terms which describes the macroscopic structure of bone. Fine trabecular, coarse trabecular, porous cortical and dense cortical. The trabecular term denotes the cancellous bone. It could be either fine or coarse, and the cortical bone is the outer cortex, which could be either porous or dense. Depending on these four basic structures, macroscopic structure of bone, there could be four classification of bone densities given by misch. It is given here in the order of increasing density. Fine trabecular is the least dense bone, whereas the dense cortical bone is the most dense bone. Now with these four terms, let us see how misch classified bone densities. When there is primarily dense cortical bone, it is denoted as D1. When there is thick porous cortical bone on the outer crest with coarse trabecular bone underneath, it is denoted as D2. When there is thin porous cortical crest with finer trabecular within, then it is D3. When there is no crestal cortical bone, only with the fine trabecular bone inside, which occupies almost total bone volume, it is D4. Now let us see the common sites where D1, D2, D3 and D4 type of dense bones are present. D1 type of bone density is seen mostly in the anterior mandible. D2 is seen in anterior mandible, posterior mandible and anterior maxilla. D3 is seen in anterior maxilla and posterior maxilla, whereas D4 is commonly seen in posterior maxilla. D5 is the term used to denote the immature bone which is usually developing after graft placement. The type of bone density present in an area can be determined by either tactile sense, which is seen during surgery, or the general location which we saw before, or by radiographic evaluation by CBCT. Classifying bone depending on their densities and knowing it before starting the treatment planning for implant helps us to decide the treatment plan based on that, which reduces failure of implants and longevity of successful implants. Thus we saw how misch classified bone depending on their densities. See you soon in the next video.